So much to our viewers on KUAM TV for sharing your Friday morning with us. We appreciate it. We have a great day of programming on the way on KUAM TV, so definitely appreciate you guys sticking by us. And jump on over to our Facebook Live feed. We're also on the radio, of course, KUAM FM in Agotni, Guam. It's The Breeze, The Link. My name is Chris.
I'm Sabrina.
Esta Betnes. Adios.
Bye.
Back. All right, let's just jump right into the KUAM News Zoom room. I want to call an audible here. We're going to go to Nicole Flores. Nicole.
Hang on.
Yeah, let's get her in here. And then we've got Dr. Felix Cabrera. We've got Sam Titano from Manetlu to talk about what they're doing, and then also this outreach that's going on up north in the target testing. But I wanted to bring Nicole on. Nicole, so your husband and you are over there at the Northern Public Health.
When she hasn't got audio yet.
Okay, she's gonna your audio, Nicole. It's first time Zoomer maybe.
Oh yeah, here it comes.
Okay, here it comes. So Nicole, his husband works at the Port Authority of Guam, where yesterday we saw the news read that they had some additional positives. So her husband works in the same office as one of those positives, and they're up in line at Northern Public Health. I shot you a picture if you want to pop that up if you're able, to get tested. Nicole, we'll just start right at the beginning. What can you tell us about that positive in the port? What office is it? And can you give us any other information than what we've already seen out of the port?
I'm sorry. I didn't quite hear the question.
Just tell us what you know about the positive at the port. So your husband works in the same office as one of these positives, and now you guys are up at Northern Public Health in line to get tested at the instruction of the port's Human Resources Department, right?
Yeah. So my husband didn't come into work Monday due to me being sick. You know, he needs to help me out and being care for me. But while he was home, he got a phone call from HR that one of his coworkers tested positive over the weekend. And so they told him that they're going to schedule him for a COVID testing. And now we're here since Monday when we got the phone call, and it's already Friday. And I was concerned because not only Monday we got a call, but Tuesday we got the message that another his coworker is sick. And then we got another call Wednesday that another coworker is sick. And my husband didn't go to work Monday, Tuesday, Wednesday overall just because he's taking care of me. And lucky he didn't go in because the last time he saw the one that started being positive was Friday. But he wasn't aware that, you know, anyone was sick. Of course, they're staying safe, protected, everything, you know, protocol-wise that you're supposed to do. But the thing is what's frustrating is we got the call Monday and we're only going to get tested today. And everyone was getting sick day by day by day. And it's crazy because we have to wait that long to get tested. And then you want your poor employee to come to work after getting tested until you get the results. It's frustrating because my husband has health issues as well, but he is doing everything to stay safe and be protected. And then I have health issues since 2014, thanks to GMH. But why are we in this position? Why hasn't public health sorted out their situation of getting the people tested right away? Because I'm talking about the person got sick Friday night, got tested Saturday, it's positive, but they didn't get the word till Monday. Another one was sick Sunday, but we didn't get the word till Tuesday for that person that was starting to get sick Sunday. My husband and I are very hopeful right now because he didn't go in Monday, Tuesday, Wednesday because he was at home with us taking care of me. So now we're in line, waiting, and it's very stressful. It's very stressful to find out if he's positive or not because we have 3 kids at home and myself, and both of us have underlying health issues.
What office does your husband work in? Is he in the customs office or another area?
No, he's in the fleet office.
Okay.
And there's 11 of them from what we're counting.
Yeah. Yeah, Nicole, just being familiar with the testing protocol, because we also had a positive here a couple months ago, is public health recommends getting tested 5 to 7 days after exposure. And so I just got a message from the GM, Rory, and he said the reason for the test being scheduled today was at the recommendation of public health because of the incubation period. But, you know, one thing you said that I want to key in on is your husband being told to report to work after the testing?
No, he's not being told to report to work, but he's not also being told not to go to work. And the thing is, it's, Rory messaged me too. And the thing is what I question him is, how do you know the contact tracing is happening when it's his people? I was writing to him, but I actually deleted because I'm frustrated. Public health is not doing the contact tracing. It's the people itself, then reporting it to HR. After HR, I really don't know what's going on because we have to backtrack who was our surrounding, who was next to my husband, who was by my husband, where did my husband go before coming home? Because he does parts run and he's out there, at different auto shops. So how do you know where that person got sick and say that person went out partying with his family or a gathering and he didn't get it from the port, but he brought it to the port? How do you know that when public health is not the one? It's us researching and then reporting it to HR of what we know. Then public health looks for it. We haven't been in contact with public health. It's just HR.
Right. I think the port has their own contact tracing team.
Well,
I don't know what team that is, but I would like to know what team that is because they should pay me because I'm part of the team trying to figure it out too.
You sound very frustrated, and rightfully so. This is a scary time, Nicole. How worried are you as you wait in line to get tested by public health? And what would your message be to the Port Strong family?
I know a lot of people down there, and my husband is 100% well known, and that's his second family. I myself is behind my husband to do whatever it is to support the Port family in any kind of way I can when it comes down to it. I cheer on for the people at Port because that is a second family. That is what is paying us. But when you go to work, you want to be, mind-free and ready to work with the people that you made family with because that is your career. And knowing my husband had a heart attack twice from stress, and then hearing that his fellow coworkers, his brothers, are falling ill, I am so scared to death because he's like he's the one that they count on. He's like the heart of his shop. That's how I see it. And that's how everyone knows. My husband is the heart of his work. And without your heart pumping, you know what's going to happen to you, right? So I'm fearing he's not able to work. It has nothing to do with that. It has to do with if he's positive, what happens to us? What happens to him? What happens to if something should happen to him? Who's going to care for us? Who's going to care for our kids? He is the breadwinner. And I hope and pray that the guys that are sick and ill at the moment, I hope and pray they get better because I really am scared for them. There's one in particular and he's in GMH and I am hoping that he's going to get released, but he's still in the hospital.
Nicole, thank you for coming on. I know it was last minute, but I definitely wanted to get, because we hear from Rory all the time. We get the press releases, but I wanted to really hear a voice from somebody who's in this and embedded. And your husband and you definitely need to be heard. So I thank you for reaching
I
out.
mean, don't get me wrong. Rory's doing a wonderful job. It's just sometimes you think you know everything and you're running everything, but really there's little bits and pieces that you don't know. For example, the contact tracing. You know, he believes that they're doing their good, their best, and they're in contact with public health, but I don't see why we, the family, are backtracking our steps to make sure we're okay and that it was none of us, because we don't know if we're asymptomatic. We don't know if we're the one that's getting the other people sick, but we've been doing our part, staying home, going to leave for groceries, medications, and medical needs, and back home. We are not out there at the beaches, although we want to. Right. I got 3 kids. You know, I got a teenager, and then I got a pre-teenager, and then I have a 6-year-old. We've been at home. You know, I thank the Port family, and I really am praying for them, and I'm praying for everyone that's infected and everyone else that has been through this and lost a loved one. Because right now, my butt is the driver, and I'm so nervous for my husband. Because the one thing he told me this morning is, I don't feel too good.
Oh. Keep us posted, Nicole.
He just said he just doesn't feel good.
Right, yeah. I don't blame him. I mean, even if it isn't COVID, who feels good this time? Crazy.
Yeah.
Thank you for sharing. Go ahead.
Thank you.
Yeah. And keep us posted. You got my number. Let us know what the results are and how the testing goes for you. How long is the line there? Can you flip your phone and show us how many people are getting tested up in Northern Public Health?
The line is pretty long. Let me try. There we go. Let's see. We're in the backside. Yeah, the line is going out towards Weddingdale.
Wow. Thank you, Nicole, so much. Be safe, okay?
Thank you, Chris.
And keep us posted.
Stay safe. Hope everything's all right.
Yeah, we're praying for the Port family and all the families this morning. Appreciate it. Wash your hands. Grab you a virtual cinnamon roll because it looks like you guys are going to be in line for a while.
Yes, we are. Have a good day.
You too. Agamas. Esta. It's 8:17. Let's just stay in the KUAM News Zoom room. We're going to let our little sanitizing